Hey, everybody. We are back talking again about another important topic in how to live your dream life, how to live as long as you can for as well as you can. We feel so passionately about helping patients live whatever their definition of their best life is. And
Mhm.
today we are going to talk with my brother about inflammation, which is kind of a buzzword in the world of medicine and the internet world and beyond, but super relevant and actually very measurable and actionable, especially in the
Mhm.
world of cardiology, but general health too. So, can you kind of talk about really is inflammation? Not just like the buzzword inflammation, but what are we really talking about?
Yeah, so inflammation, you're right, is a huge buzzword that I think gets thrown around a lot, but I think we need to know what it actually means, and we can actually measure it to know if you actually have medically meaningful inflammation. So our immune system is something that we are all very fortunate we have. We could not live without it, and that is there for if we have an infection or a big traumatic event. Our immune system is there to help fight off infections like bacteria, virus, other pathogens, things that could cause us problems. And so that's what our immune system is for. However, in modern society, we are seeing a phenomenon where people often have chronic low-grade levels of inflammation where their immune system is sort of overactivated inappropriately. And that can cause damage to different tissues, like our vascular system, different organs like our heart, as I know we'll get into, Christie, with you, and weight loss with our liver. That can cause a lot of problems. And so it's been shown in studies that higher levels of inflammation put you at higher risk for things like cardiovascular disease. Obviously, it's going to put you at risk for liver problems, and numerous other things as well.
Cancer, yeah.
Cancer, yes, because just so you know, if you have inflammation inappropriately, that can be damaging things. And when tissues or organs are damaged, they need to repair themselves. And anytime our body attempts to repair itself or repair DNA that was damaged, there's a chance that a mistake could be made and cause a mutation. And if there's a mutation, that mutation could cause, the cell to kind of replicate without really any inhibition and causing a bad cell to keep producing and producing, eventually causing cancer and organ dysfunction and damage, et cetera. So for a variety of reasons, inflammation is something I think everyone should know, whether they have elevated levels or not. And if they have it, then work to address that.
You're kind of alluding to this here, but we can measure this, right? This isn't just like
Yes.
a vague thing. How do we measure it?
Yeah, so there's a couple things. One, there's a couple blood tests I like to order on my patients to see, hey, what are your levels of inflammation? So there's two blood tests off the top of my head that I frequently order. But then also there's sort of some imaging that I know you like to order on a
Hmm.
lot of your patients because sometimes I'm looking at inflammation that's in the blood. Well, what about things that are inflammation related to an actual organ? So it's not in our blood, although I think
Yeah.
tend to two birds of a feather tend to flock together on that. But actually on the organ, in the surrounding organ, causing visceral inflammation, which is a huge risk factor for chronic disease. So can you talk about the imaging test you like to do for patients to see if they have um, a finding that might put them at risk for liver inflammation?
Yeah. So I think most people are probably familiar with the disease of fatty liver. That's kind of the old
Mhm.
term for it. We have a larger, longer term that's abbreviated as MASLD now. And basically, what's happening, and I explained this in one of our weight management videos also, when you have extra calories that come in that are stored as fat cells and you kind of run out of room and you're in other places to store fat, you start depositing them among your visceral organs or your organs inside deeper. One of the main places we see that is around the liver. When that fat gets deposited around the liver and the cells start growing, inflammation ensues. Those fat cells just aren't working right, and the body senses that and triggers these inflammation responses. What's the big deal about that? Over time, that inflammation can turn to scarring, and scarring is what's going on when we say cirrhosis or really liver failure. It's when there's scarring under there. And even more than that, Scotty's talking about that, when there's inflammation and there's damage, there's need for repairs, there's a chance for a cancer. And we do see that patients who have that scarring of the liver or high levels of liver inflammation are at higher risk for liver cancer. So I do a scan in my clinic called FibroScan. And this is something that's, I think, way underutilized. It's an ultrasound based test. that takes just a couple of minutes to tell if you have fat around your liver and if you have scarring around your liver. And that would imply also likely some inflammation. Um, so I'm hopeful that as we are doing more and more of this, we'll get ahead of the game and be able to stop that inflammatory cascade before it gets to the liver cancers and the liver failure.
So basically, as a cardiologist, I care because it's going to damage your blood vessels, your heart, your brain vessels, which is going to cause, risk factors for, cardiovascular disease, which I'm trying to prevent. And we can test that with the blood marker. And you as a weight loss specialist can order tests to see if people are at risk for liver problems because of inflammation that is likely due to liver fat. So
yeah,
huge thing that, maybe not everybody should need a fiber scan, definitely a lot of people, but everyone for sure get your blood tested to see if you have high levels of inflammation.
What are those blood tests so people know?
Yeah, so I think the two that I like to use are, one's called a C-reactive protein, which is actually a protein that the liver makes in response to inflammation. And that has been shown in numerous trials to be associated with higher risks of cardiovascular disease. The other test that I like is called IL-6, interleukin 6, which is actually a little upstream the pathway from the inflammatory pathway from CRP. That's a marker, and that actually has been shown in one trial to actually be even a better predictor than CRP. However, there's more data on CRP, so I kind of use both of them.
I know CRP is like a pretty cheap test, I would imagine. I don't know, is IL-6 expensive?
Yeah, I have never had any pushbacks from patients on payment issues. Obviously, every insurance is different. But I think for the most part, this is well worth it and generally not expensive.
Cool. So patient comes to you, they have a high CRP, they have an high interleukin 6 level. What do you do? How do you cancel them to act?
Yeah, first thing is I'd probably ask questions to make sure they're not having some sort of acute illness, because if you have an infection and you're sick from something, you will have elevated markers of this. So that's one thing. The second thing, I want to ask some general questions do they have like an underlying inflammatory autoimmune condition like lupus or rheumatoid arthritis or psoriasis? But assuming that all those things are not the case and they generally have elevations, the number one reason why people have elevated inflammatory markers in their blood is because of excess calories and overweight. So weight loss, very, very important if it is found to be present. And, in fact, there was a big trial recently that I think really highlights this, is that it was the semaglutide trial, which is these injectable weight loss, Wegovy, Ozempic, semaglutide is the generic version of them. And then it showed that there was a 20% reduction in people who were overweight and had a history of coronary disease, 20% reduction of heart attacks and strokes because of this. And so that's great. Like, that's awesome. It's amazing. And they wanted to know, like, well, why is this happening? Like, did the weight loss cause a blood pressure change, or did they improve their blood sugar, or was it their cholesterol, or what really got better? And really the only thing that actually got much better was there was a 37% reduction in CRP, this inflammatory marker. So I look at that and I'm saying, like, that's probably the reason that they had a 20% reduction in all these really bad heart things, is because their inflammation significantly was reduced. So that's the number
Another
one
reason why these medicines are amazing.
Yeah. But even, if you don't want to do a medicine, that's fine, or can't get a hold of it, that's fine. Natural weight loss is going to do the same thing. It's going to lower your inflammation. So that is the biggest thing I would say. Then there's some evidence that sort of some dietary patterns can be helpful. Like a Mediterranean diet in general tends to be lower rates of inflammation. I don't know that it's going to take somebody from a massively elevated CRP to completely normal, unless there's weight loss involved there, but that could help. And then the other thing that I think, there's some evidence that maybe exercise might reduce these things. It's not great evidence, but there's some evidence there. I heard some anecdotal evidence of some dietary changes, like if people had gluten or lactose issues. However, I will say that's pretty anecdotal, and I don't know that I can say with confidence that there's good data behind it. But if you wanted to try that,
Worth a shot. Yeah.
But then the last thing is, it also lets us know it's what we call a risk enhancing marker. So it says, hey, you have this little bit higher levels of inflammation. We should try to work on that. But that also means that it's even more important to get all the other risk factors under control. So if you have high levels of inflammation, we really got to get your blood pressure under control. We really got to get your cholesterol under control. We really got to get your metabolic health and blood sugar under control, because all those things are even worse than they already are by themselves in the presence of high inflammation. So that's kind of the general approach I like to take with people. But you don't know until you get it checked. So
Yeah.
I really think everyone should know their levels of inflammation.
I think that's such a cool thing that we have these tools now, because before we had things like, CRP, interleukin-6, before I had a FibroScan, we just didn't know, and you can't do
Hmm.
anything about something if you don't know what's happening, right? So, I think we're both like so huge on information, and knowledge is so powerful and such a
Hmm.
motivator. So now we have the ability to pretty easily, with one blood test or a 10-minute ultrasound, say, oh, like, we're able to triage you to the top of our list, and you're able to be like, oh man, I really got to pay attention to this because this is important. So
Yeah,
many great tools we have.
it's true. We have so many tools, and the key is we just gotta, don't start too late. I
Hmm.
think people often wait till they're, been exposed to high levels of inflammation or high levels of pick a health marker. Um,
Or they're
and
not feeling well, and so they go,
Yeah, right. It's
yeah,
like, let's get ahead of the curve, like your future self is gonna thank you because 10 years ago or 5 years ago or whatever, you took this seriously. And so inflammation is one of the things that I think is very important to know, but also can be cool because maybe some people might, lose 10 pounds or whatever, and they're like, 10 pounds, what's the big deal? But if that lowers your inflammation, that's awesome. So it's another sort of cool marker to see, like, yeah, this is working, this is helping, even if you might not feel like it was a big change on the scale.
totally. I'll just say one more thing before we wrap up, but like, we many of our obesity
I'm not
related
sure I
studies show
understand.
us that we only that we only need like 5 or 10% weight loss to start
Yes.
seeing improvement in things like inflammation, blood pressure, cholesterol. And that maybe doesn't look like a big number on the scale. And it's great that even with such a small amount of change, you're able to make a big impact on overall health.
Yeah, totally agree. There's a lot of things we can do, but we're better doctors when we're not working in the dark, and we're better
Yeah,
doctors when we start earlier on. So
for sure.
if you never had your blood tested to see if you have levels of inflammation or any of these markers that we're talking about, do it. Please go do it. I would love it if you'd be with us at our clinics, at Kirkpatrick Family Care. Call 360-423-9580 to get an
Shameless
appointment.
plug.
Shameless plug. But if, it doesn't have to be us, just go to your doctor and get these things tested. I think it's worth it.
Great. Well, everybody keep an eye out on our social media feeds for more videos, and we'll see you next time.